And as we learn more about the spread of coronavirus in Florida, there are concerns that the state leaders waited 24 hours before telling the public.
ABC 27's investigator Katie LaGrone asked both the governor and the state's top doctor why.
In a media-filled conference room at a state lab in Tampa, Governor Ron DeSantis and newly appointed State Surgeon General Dr. Scott Rifkes attempted to ease concerns about Florida's first 2 cases of the coronavirus, now confirmed in Tampa Bay.
We have an incident management team in place and we're working in lockstep with the CDC.
But as new details emerged about the 2 patients who are now isolated, so too did a timeline that reveals state leaders knew about its first cases of coronavirus a full day before informing the public about them.
Doctor, you knew about this 24 hours before it was publicly announced?
We became aware of this Saturday evening.
And it wasn't announced to the public until Sunday night?
These individuals were identified as presumptive positives because we're doing the state laboratory. And then according to the CDC, we're supposed to send the samples to them where they do confirmatory testing.
The state's top doctor said immediately they contained and evaluated the patients, but it wasn't until Sunday night just after 9:30, a full day later, before the governor's press office made the news public through this executive order declaring a state of emergency over the coronavirus, adding few details about the state's first 2 cases, 7 paragraphs down.
We have always been very proactive in terms of letting the public know that this is coming and how to prepare ourselves.
Doctor, you knew about it 24 hours before you announced it to the public, so that's not transparent, sir.
Excuse me.
I feel disappointed in that.
Florida Senator Janet Cruz found out last night watching the news.
I think moving forward, we can't wait 24 hours. The public deserves to know. They deserve to know what's happening in their state.
And while the number of cases in the state will likely increase, the risk state health leaders say to the overall public is very low.